information, and you can have it for your files. But it goes through what surgery you had, it goes through your history and physical. But this is, I mean, it's your medical information. You just have to go about acquiring it the right way through medical records. But it's your information.
But I need to understand, when you went over my cervical, the way that doctor explained the severity of me having to have this thing, I'd like to know when Dr. Tyrone Harding did my cervical C4 through 7, and then they're telling me now they did my C4 through 1, which you said is a C4 through T1.
I'm not seeing that here. So what I'm seeing here, and I can show you all this information, but I can't give you a copy of it.
Yeah, I just want to be clear and understand what the heck happened to me.
So you had a prior fusion and pseudoarthrosis, and your discharge was a prior fusion and a confirmed pseudoarthrosis. Okay. Meaning, I actually don't know what that means, but you are status post a prior C4 through 7 ACDF.
What does that mean?
We looked this up, and it was an anterior. I'd have to look it up again, dear. But C4 through 7, so only your cervical vertebrae.
Okay.
Okay, that's all they touched. You had L4 through S1 ALIF.
That was in the past.
That was in the past, but that's lower. That's
right, and the L5
through S1.
And the L5.
So L4 through S1, so right. Way low on your lumbar spine onto your sacrum, L4
So
through
what
S1.
did the doctors at UCSF do to me?
Now, presents with worsening chronic intermittent pain and paresthesias, numbness down your right arm, left leg over the past 5 days. You endorsed bilateral hand and leg weakness since February of 2018. All of these symptoms were chronic. So you were taken to the operating room on 5/17/2018, and they did a C4 through T1 arthrodesis for a posterior spinal fusion.
Which was already done.
So I would need to relook up ACDF to know what that means. I don't remember what that acronym is. I don't see it very often. But a C4 through T1 arthrodesis with a spinal fusion, a placement of bilateral, so both sides of your C4 through 6 lateral mass screws, okay? Placement of bilateral T1 screws. They explored your previous fusion. Mm-hmm. And they did an intraoperative CT scan.
What the heck was that?
An intraoperative CT scan, meaning during your surgery, they did a CT scan, I think just to make sure everything looked okay.
So what did they go in there and did? So that means that they overlapped the work that was already done, the previous job? Because
I thought they just, if they overlapped or if they modified what had already been done. I'm not sure. Your attending physician was Aaron Clark, MD. I can write that name down. I don't have a phone number here. Okay. But if you want more information, you can talk to Dr. Clark.
Is there a reason why that neurosurgeon did this type of procedure on me and then did not want to concur with me in follow-up care?
I don't have an answer for that.
I know you can't compensate for that. But I'm saying for that type of procedure, you would want to have done follow-up with the patient to give them thorough explanation of what you did, why you did it. Because I was out of my mind. I was blacked out, had no understanding, And the explanation I was given was something about the bone was sticking out, and that with that previous surgery, that the bones did not fuse properly
Okay.
with the C4 through 7, and they needed to correct it because those two bones were not fusing.
Okay.
And that's why I was suffering the pain that I was suffering. But they looked like to me they redid what was already done and not giving me an explanation. And I'm
Okay.
lying here, and you yourself experienced with me in therapy when my thumb gave out and that numbness, just what you just explained.
Yeah.
I experienced that in therapy
Yeah.
when they felt that I didn't need any further therapy. When they were saying, "Oh, you discharged me from therapy and you never had."
Okay.
You discharged me from the fact that I can bathe myself. But they was like, "Oh no, Winona," the therapist said, there's nothing anymore they can do for you or whatever." But they lied on you because that is not what was said.
So what
I didn't appreciate that.
So what I can tell you is that I am a lowly occupational therapist. I'm not a neurosurgeon. So
I know you're not.
A lot of this is way
Above
over my head, above my pay grade.
both our head.
Yeah, over both of our heads. So what I can do is give you Dr. Clark's full name, and he was at UCSF, so that should be easy to find him.
Okay.
And maybe you can call him. I don't know if it would be him explaining it or like a medical assistant explaining what they did. But it sounds like you need just a follow-up appointment with your neurosurgeon.
I was given a follow-up appointment, but I was refused it.
Oh, okay.
They said the paramedics could not take me over there because they wasn't receiving ambulance.
Oh, they were on a diversion, an ambulance diversion.
On 2 occasions?
On 2 occasions. Okay. I don't know.
I never heard of, what is an ambulance diversion?
When they're full or they're not accepting ambulances, so they send you to another hospital.
Based on, so they would have taken me based on certain severities?
I don't know why they would be on a diversion. I don't know. I don't work at a hospital. Just tell me what I know.
So there is a such thing of an ambulance. Well, that's when I understand that because I was at the in Vegas when they had the Mandalay shooting. It was right at my door,
Yeah.
so I can understand in situations like that,
Yeah.
ambulatory diversion.
Yeah.
That's why I didn't go to the hospital when the ceiling bust me upside the head,
Sure.
because I felt like there were people that were in more worse condition, so I diverted.
Yeah.
I created my own mental diversion. Let those people who are in more severe, shape than I was in,
Yeah.
so I waited till like 12 hours later before I went into the hospital. I'm talking about they were taking people at children's hospital.
Yeah.
So that's the diversion. That's why I see it in retrospect of a diversion.
Okay.
But not a person that you have just done this type of surgery on.
Okay.
You don't receive them.
Okay. If I were you though, I would definitely ask for a copy of your medical records from our medical records department.
Okay.
They probably just have you sign a form saying, yes, I agree to receiving this information, and they give you whatever you want because it's your information. This is for your information as well as Stephanie. She's learning. So a sniff like this, we take you in at your worst. We rehab you to a point where you can step down to a lower level of care. So we're not saying that you are fixed or cured or any of that. We're saying that we have gotten you to a place where you could possibly go to outpatient and get more refined hand therapy. You would be a candidate for hand therapy at this point. I'm not a hand therapist. None of the OTs on our staff are hand therapists. We're also lacking in the appropriate equipment for what you might need.
I know they lack the appropriate equipment to get the staples out of me.
There might come a day when I don't know if you have a history of cancer?
I just beat stomach cancer.
Just beat stomach cancer? Okay. So they probably wouldn't do e-stim, electrical stim on your shoulder if you have a history of cancer.
That one incident was considered a history then.
Any history is a history.
Because I learned that H. pylori was like the seed to cancer.
Yeah.
It's the beginning stages of cancer.
Okay, I didn't know that. I would need to look
I,
up that information.
I found out the hard way.
Okay.
Because it developed, because it went unattended, because
Okay.
after a lot of blood work here and there,
Sure.
it came back that I had H. pylori, but it had developed into, it was 1.7 stage of 2 of cancer.
Okay.
It was approaching stage 2 of stomach cancer, and it was
Well,
hell.
thank God you beat it.
Yeah, because they caught it in time to address it.
Okay. So with a hand therapist, they do hundreds of hours of additional training. They have very refined assessments that can see what your nerve functioning is, what your strength is. Our assessments are very, very gross. They're these overarching big broad assessments, but a hand therapist could do a much more refined
Could that been
assessment.
associated with with the have its effect from the rotator cuff? Because I didn't have these issues until I got hit by that cab.
Okay.
And then that's when all of this started happening, when I got hit by Lucky Cab in Las Vegas. That because it shifted when it knocked my cane out my hand, the trunk of the cab, when he stabbed on the brakes, hit knocked the cane out, and when it hit my hand, it shifted my whole shoulder up into my neck, and that caused my rotator cuff to press, and I went to fall. The guy jumps out and grabs me. He breaks my fall, and my arm was like stuck in my neck.
Yeah.
It took a while for it to come down, and so I had to go and get an MRI, and that's when my C4 through 7 was endangered, and they had to go in and do that emergency surgery, or according to my doctor, I would have been paralyzed from the neck down.
Okay. Well, thank
Again.
goodness that didn't happen either. It very well could have been the accident, but it could also just be a result of having your neck operated on when they cut through all of those nerves. I mean, anything can happen, and if there is any nerve impingement, that's where it might happen. There might be nerve impingement as a result of all the hardware in there, all of the surgeries you've had. It could have impinged your radial nerve in your arm, causing the weakness, causing the numbness, which is maybe why it comes and goes a little bit. If you turn your neck a certain way, or if you've been resting and you know that during the day